As we are now familiar with the 5 steps of the medical approach to a patient, let's look at the approach AI will take to treat a patient. The general flow of the approach remains the same, but there are some steps which AI can help physicians with. For example, in the first step of checking the medical history of the patient, data analysis can be performed. In physical examination, AI can help to get a general impression of the status of the patient before inspection begins. Moreover, they can help monitor the blood pressure and heart rate. Lastly, AI can help with diagnosis by analyzing the X-ray images and designing the cancer malignancy. In each step of the medical approach to the patient, there are different skills that AI must perform, and we're going to break them down one by one in the remaining of this video. First, let's begin with medical history. Medical records are written in human language, which computers cannot easily interpret. Natural language processing, NLP, must be adopted before AI can perform data analysis. There are 2 main steps in NLP: text processing and classification. In text processing, syntactic keywords are looked for to see how different concepts are linked together, while semantic keywords are highlighted to understand the general concepts of the human sentence, such as location and size of the tumor and severity of burn, and hence classify them. Diseases and disorders are classified according to the in-house classification schemes and international schemes such as ICD-10 and MASH. After text processing, classification links the general concepts together and form meanings. It is unlike how individual words are typed into the search bar of the search engine. Meaning of the sentence must be deciphered to learn more about the diseases. Let me give you an example of how NLP works. A study was done in year 2000 to compare the ability of NLP in detecting pneumonia concepts in radiological reports to keyword search engines, physicians, and lay people. There are 3 main concepts that are tested. They are pneumonia, infiltrate compatible with acute bacterial pneumonia, and aspiration. These key concepts are important for treatment choice as they reflect the types of pneumonia. Viral pneumonia versus bacterial pneumonia, different organisms in aspiration pneumonia versus community-acquired pneumonia. The design of the NLP used in this study checks for 3 components in the language. Firstly, the syntactic component, which are the linking words. Secondly, the NLP makes use of the Bayesian network to conceptualize the semantic components of the report. And thirdly, it infers the disease state based on the concepts extracted. The results of this study showed that NLP was better than keyword search engines and lay people in identifying each specific type of pneumonia and performed similarly as physicians. The results conclude that NLP may be able to be applied to the antibiotic assistance program to rationalize the use of antibiotics. Furthermore, there are other applications of NLP in healthcare. Examples include quality control and mining of cases for clinical studies. We can use potential algorithms for automatic identification of post-operative complications, cases of peripheral arterial diseases, and cerebral aneurysms in medical records. It may sound all nice and good on paper with the applications of NLP, but are they really applicable in real-life clinical settings? In Hong Kong, many of the medical reports and progress reports are still handwritten. They hindered the development of adopting AI in healthcare in Hong Kong. In addition, let's think about whether there is a generalized guideline that sheds some light on how to use NLP in healthcare. If not, how are we supposed to know if we infringe on the patient's privacy? And how about patient care, especially if there is an outpatient setting? These are the questions we must think about if we are to apply AI in clinical care. In 2018, a machine learning model was published, and the authors suggested the use of model in real-time prediction of clinical outcomes in the ICU. A recurrent deep neural network model was used and was trained by past patients' data. The predicted outcome can be generated in real time by obtaining the latest data from the patients, such as bleeding, mortality, and renal failure. The model is compared to the existing clinical guidelines for its performance. It performed statistically better than the existing guidelines.